start discussing about optic neuritis. The optic neuritis most commonly associated with multiple sclerosis. So how much is the association between optic neuritis and multiple sclerosis? So in patients having multiple sclerosis, about 50% of them will develop optic neuritis in some part of their lifetime. Whereas if a patient is having optic neuritis, then the chances of developing MS, multiple sclerosis, in their lifetime depends on whether the patient is having subclinical brain MRI lesions or not. If along with optic neuritis you do a brain MRI and find out subclinical brain MRI lesions, then the risk of developing multiple sclerosis within 10 years is 56%. But if there are no such lesions found on MRI, and the risk of developing MS in further 10 years is only 22%. Now, how is the presentation of this optic neuritis? Patients present within 20 to 50 years of age with median age is 30 years. It is subacute unilateral visual impairment. It is subacute and unilateral visual impairment. It can be associated with pain on ocular movements. The pain on ocular movements may precede or accompany the visual loss. Now on examination, the visual acuity is between 6 by 18 to 6 by 60. There is afferent pupillary defect. The color vision, the light brightness appreciation, the contrast sensitivity are reduced. On the fundus examination, it is mainly a retrobulbar optic neuritis, so the disc will be usually normal. Then, what next? How is the course of this disease? So, optic neuritis, in the first 2 weeks, the vision will start deteriorating. And the further 2 to 4 weeks, it will start improving gradually. Almost 85% patients will have about 6 by 12 vision. Okay, or more. Some 10% patients can develop chronic optic neuritis. Now, recurrent attack of optic neuritis is rare, but if it occurs, optic atrophy may occur. So, what is the treatment? Okay, before coming to the treatment part, as I was telling you, the signs. So, in optic neuritis, you will see signs of optic nerve dysfunction. One more sign is visual field defect. So, initially, there will be diffuse depression of the sensitivity of the entire central 30 degrees. Diffuse depression of the entire central 30 degrees sensitivity. The nerve, then visual field defect will be of a central scotoma. Okay, so now coming to the treatment part. So treatment is indicated if the visual acuity is less than 6 by 12 in the first week. The treatment will hasten this, it will speeden up the recovery by 2 or 3 weeks. This is the only advantage. The final visual outcome is similar, even if you don't treat. Treatment may be important in patients who have only one seeing eye or the other eye visual acuity is less, or because of occupational requirement. So what is the treatment? IV methylprednisolone sodium succinate 1 gram daily for 3 days, followed by oral steroid for 11 days and then tapered for 3 days. Now second treatment part will be intramuscular injection of interferon beta 1A. This may be given in patients who have subclinical brain MR lesions along with optic neuritis. This may delay the development of multiple sclerosis by about 3 years. Remember that oral steroid, huh? If you give only oral steroids, then first of all it will not speed up the recovery, and secondly it can increase the recurrence rate. So that's all about optic neuritis.